I'm Dr. Zachary Stender. I grew up in downtown Chicago and went to college at the University of Wisconsin-Madison. I went to medical school at Chicago Medical School. I did my residency in orthopedic surgery at University of Connecticut. I did a fellowship in sports medicine at the Detroit Medical Center. I practiced initially for 5 years in Chicago, and I decided that it was a time for a change, and I then did a 6-month comprehensive search identifying what I felt were the best things in orthopedic practice and identified them here, and that's how I ended up in Canton, Ohio. I think a big benefit of OrthoUnited is we took 2 powerhouse groups in Canton, Ohio and merged them together. And we were able to take that synergy of 2 really high-performing groups and create basically a super group here in Ohio where we can deliver state-of-the-art care in almost every single orthopedic specialty. So I see a wide variety of patients. My specialty is sports medicine. However, sports medicine doesn't always mean playing basketball or soccer. It often means just getting back to things that you really like doing, whether that's taking walks or gardening or just having fun with your friends. It also means soccer and basketball and now pickleball. Golf is a big one. But basically I see patients from all different levels of age and experience, and they all would like to get back to what they're doing. It's not necessarily a sport. So I think the common thing that ties my patients together is people end up coming into our orthopedic office because their life in some way is compromised secondary to pain or dysfunction from an injury or just something that's been nagging them for a long time. And one of the most rewarding parts of being an orthopedic surgeon is taking these patients who come into your office on their first visit and they're visibly upset and sometimes emotionally upset that they can't do the things that they would like to do day to day, or do the sport that they'd like to play, or the activity, or maybe it's whatever they have is disrupting their sleep, which can really affect their life. And one of the most rewarding aspects of the practice, or practicing orthopedic surgery, is being able to help them work through that initial visit and taking them through the steps, whether it's surgery or even non-operative management, all the way to the end in which they're back and able to do the things that they would like to do. And that's a really rewarding aspect of our practice. I would say one of the most unique aspects of my practice since I came to Ohio from Chicago is how closely we work directly with the high schools and the athletes at these high schools. For the last 5.5, 6 years, I've been on the sidelines with my partner at Massillon High School taking care of their football team and their whole athletic department. And recently I've been taking care of Carrollton's football team and their athletic department. And it's incredible how fast, we can get these patients in, seen, and taken care of and back onto the field. So one of the unique things about being on the sidelines as the team doctor is a lot of times you're seeing patients after they've been injured and they present to your office, but this is a unique opportunity to see them from the very first moment they get injured and the emotional distress that they're going through and sometimes the physical pain. And you can be there to take care of them literally from the first moment all the way through their healing process till when they get back on the field and they're back performing at a high level. The huge advantage of an orthopedic urgent care is you're not going to be triaged and then referred to orthopedics. You are going to see an orthopedic specialist from your first visit, and you will get the imaging and diagnostic techniques that you need from the very beginning. So a huge advantage of OrthoUnited is we have orthopedic specialized surgery centers where the surgeries that are performed every day are only orthopedic. There's no way that you can get the same level of expertise at a hospital or general setting where they're performing all types of different surgeries as you can at an orthopedic surgery center where everyone on the team specializes in just orthopedic procedures and procedures that we perform all of the time, routinely, day in and day out, and really have expertise in this specific area. Our surgery centers have state-of-the-art equipment to provide the latest and best orthopedic procedures that are currently available. I would say something that we do really well at OrthoUnited is collaborate. Not one orthopedic surgeon is going to take care of every single body part, and we do a fabulous job of communicating amongst each other to coordinate care. Maybe somebody's injured multiple body parts and I'll take care of their shoulder and their knee, and my spine partner will take care of their neck or their back, or my foot and ankle partner will take care of their foot injury. But also, it spans throughout their life as a patient at OrthoUnited. Maybe one time they're coming to see me for whichever injury they have, and then they come back 6 months later with a completely different issue. We collaborate regularly on the patients to make sure that there's continuity of care and people receive the best care possible.